I can, yeah. I just wasn't sure I could hear you.
Thank you very much for checking. Thank you, Neil. Much appreciated.
Right, I'll go on
Okay,
mute.
Chairman, the recording has now started. You are on mute at the moment, Chair. Sorry, Janice, you're muted at the moment, I'm afraid.
I can do it all again. Good evening, everybody. Welcome. Thank you all very much for attending. And of course, at the start of the meeting, may I remind everyone present that the meeting will be recorded via the internet and this recording archived for future viewing. Could all participants please mute themselves when not speaking in order to avoid any background noise or feedback when other participants are speaking? If a participant wishes to speak, can they please put their hand up if they can be seen on screen or use the raise hand function? Please ensure that all debate is raised verbally and not via the chat function for the sake of the recording. The chat function may be used to highlight any technical issues and or to grab the attention of the chairman or Democratic Services officer. If any participant has difficulty hearing or being heard when they are addressing the committee, then they should let the chairman of Democratic officer know. If they have a webcam, they then should try turning this off, as this will help with broadband or Wi-Fi or the bandwidth, so they at least can hear and be heard. And with that, thank you once more. Do we have any apologies for absence?
Chairman, none received from committee members, but Councillor Gray, as Cabinet member, wished to pass on his apologies this evening.
Thank you. Moving on to agenda item 2, the minutes of the meeting held on Len Richards, Cardiff and Vale, is waiting in the lobby.
Yep, just admitting him now, Chair.
Thank you. Agenda item 2, minutes of the meeting held on the 12th of January 2021. Would you like me to do them page by page or en bloc? Anybody, any questions? Can I move en bloc? Thank you, Julie. Which takes us to agenda item 3. Do we have any declarations of interest, including whipping declarations this evening? No, thank you. Right, agenda item 4 is the presentation Improving Care for Frail and Older People in the Vale of Glamorgan and the Sam Davis ward. And it's an update from Len Richards, the Chief Executive, and Mr. Hardcastle of Cardiff and Vale UHB. Thank you very much for attending this evening. It's really appreciated, and we've been long waiting for an update, so thank you.
Chairman, just to confirm, you do have Lisa Dunsford with you as well from the Health Board.
Thank you. And welcome, Lisa.
Mr. Richards, would you like to share your screen for the presentation slides? Oh, bear with me one moment. We can't hear you at the moment, Mr. Richards. Give me one moment. Okay, if you unmute yourself, Mr. Richards.
Yes,
there you are, lovely.
I'm here. Lisa, can you share your screen, because I haven't got the electronic copy of the presentation. And I was just going to say a few words, if that was all right, just by way of introduction, and then introduce, I think, either Lisa or Ian, who were going to present. Is that okay?
Yes, certainly. Thank you very much. Go ahead.
So thanks, Lisa. So the opening comments, I guess, are just to reflect back on the last year or so, and it won't have passed anybody by the work that we've been doing as an organisation in response to COVID and now in response to the vaccination programme. I think it's fair to say that Barry Hospital, and we'll come on to Barry Hospital, has been one of the mainstays within our response. There's been quite a lot of work going on up there, and Lisa or Ian will present on that. But I guess just to try and reassure the Scrutiny Committee the importance that Barry has played over this period of time, Barry Hospital, and the importance that we see it playing going forward. So if I maybe just hand over to Ian or Lisa, who will take you through the presentation, and the last couple of slides are specifically about Barry Hospital. Thank you.
Okay, thanks, Len. I'm trying to share, so I'm not sure. Can you see the...
We can see the slides, Lisa. Are you able to go into slide mode?
Yeah, just bear with me. My machine is a little bit slow.
That's okay. There's often a delay on the view as well. So
I
don't
have
worry.
clicked on slideshow from beginning. Yeah, can you see?
It's just moving.
Yeah.
Yes, that's much better. Thank you.
Okay, so if I just go on the slide then to the next one, which should be a picture. I don't know why it's so slow. Can you see this slide, integrated care, what we're aiming for?
I'm just on the introduction slide at the moment, I'm afraid, Lisa. It hasn't gone through to the next slide.
Okay, it's very slow.
That's okay. Would you like me to try sharing mine, and you can let me know when you'd like me to move through the slides?
Yeah, do you want to try that, and I'll just come out a second. So if I stop sharing.
It's ice on the line, Lisa.
Yeah. Okay, wait 1 second.
Yeah. Is everyone okay for me to talk through the slides now?
Yes, go ahead, please.
Okay, so what we've got, I've put a few slides together which are trying to set out what we want to achieve in relation to integrated care and care closer to home. And then the last few slides will pick up more specifically on Barry. So in relation to this first slide then, it's around how we can provide services and support for people at home and closer to home. I appreciate that the picture is very small, but there's nothing in the picture that isn't covered within the text. I think for this evening then, picking up on some of the key relevant points for us in relation to Barry and frail older people. This is around people leading more independent lives in their homes and communities. It's around ageing well, and it's about the right information, advice and care in the right place. So as I say, this is a very general slide around what we're trying to achieve, but I will refer back to it when we come on to the specific Barry ones. Chair, do you want me to pause, or are you happy just to bring people in with questions as I move through?
Having had a preview of the slides today, I think perhaps it's best if you go through it. We'll make notes and we'll ask questions at the end, unless you prefer for us to stop.
No, that's fine. I just wanted to check what was best for you. So if we move on to the next slide then, please. Okay, so with this slide as well, you'll be familiar with this. It does sort of show really the shared working across the Regional Partnership Board and the PSB. Again, particularly drawing for the Barry discussions around how the communities, sort of the local communities and the services there will work together to support people to live at home and to have services close to home. I think in relation to the home first principle, again, we talk about this as being coordinated care. We do need to pick up, we talk a lot about people coming out of hospital, but this is very much about preventing people and supporting people so they don't go into hospital. We do need crisis services as well, and we want those to be delivered as close to home as we can. And for those people who do need to go into hospital, it's about getting them home and again providing the support for them so they can live their sort of independent lives. In relation to the last box on the slide, again, quite often we will talk about sort of the care that has to be done in hospital, and of course there is care that does need to be done there. But in relation to what we are trying to achieve, it is looking where possible and where appropriate that we do provide some of that in the community. And again, I'll pick up on that when we go on to the Barry slides. If we can move on to the next one then, please. Oh, back one. So this one, it's again just to show really how we move in from some of the transformation projects that you'll be familiar with. So some of those are listed down the left-hand side, and really setting out how we are going to try and move this forward in the coming year, because we have had the transformation funding confirmed. So again, to really move forward with our integrated model of care, there will be work that's structured in the sort of the orange box at the top, and this will very much pick up on the Vale Alliance locality model, and this will be where we will be looking at the Vale Health and Wellbeing Centre. So all the work around older people, frail people will be in that area, but just for completeness then, we've also highlighted the integrated work that we'll be doing around children and young people. Because again, I think I remember a presentation around Barry, the demographics are not always, you know, the older generation, even though I appreciate that's what we are talking about this evening. So if we move on to the next slide, and this is really now to try and pick up much more specifically on the Barry points, you know, what we've set out on the slide here, and what we are keen to really get across and discuss today is that it is really central to the model of integrated care and the vision that's been picked up on the previous slides. You know, we do see the creation of the Health and Wellbeing Centre a really good opportunity to focus on well-being, and I think that's something that, you know, we do need to be clear about, that we focus on well-being as well as health services, and actually that we draw on the resources available within the community and across all of the sectors as well. In relation specifically to the frail older people, then yes, of course, that is going to be key to the work that we pick up within Barry Hospital. You know, we will need to look at the community-based beds, because, you know, people do get ill and people will sometimes need to be in the bed, but actually that they don't need to be at sort of the main hospital, UHW and UHL sites. So there is something around ensuring that we can support people to be there in their local community if they need a bed, but very much, I think, linked to our community teams, so the and the focus on rehabilitation and reablement. So again, looking at sort of the services we deliver through the Vale community resource teams, and making sure again that it's not just about someone being in the bed, that they are getting sort of the support they need to maintain their independence. So there's a few points on that slide. Before we move on, I think what I wanted to try and do, which is not captured in the slide, but just to add a little bit more, I think, behind those bullet points there, is that, and I'm going back now a long time before COVID, but we did run a workshop within Barry Hospital, and I recognise it was mainly for the health board teams. But just to reassure people again, the key messages coming across were around promoting prevention and wellness, and not just about illness. It was about bringing the community together and sort of really play into the strengths of the community and working with the community and ensuring that the services were there and the services that meet the needs of the local people. And again, very much around that the hospital and the Wellbeing Centre supporting delivery of care at home and the right support, right people at the right time. So in relation to the Health and Wellbeing Centres, whilst we do want there to be coordinated services, we have been talking about what you would see within a health zone, a wellbeing zone and a community zone. But again, I think, as I did say when I came to a meeting a long time ago now, that even though we will have some views on the sorts of services that we would expect to see there, which includes wellbeing as well as healthcare services, we are really keen, and what was on that bottom slide is that we are committed to engagement and that we do listen to what the needs of the local population are. Chair, I can see a hand up. I had one more slide, but I didn't know if you wanted me to pick up the question from Councillor Thomas now or at the end.
Carry on, Lisa, and I got my hand up ready to jump in at the end.
Okay, thank you. And there's just one more slide. So in relation to the last slide, then, if we move it on, I know that we haven't started the engagement. It was, we were in discussions and to pull together an initial plan before COVID came upon us. But again, I think just in terms of the commitment around the centre, you know, I know that the team have done a lot of work around opening the cafe, which may not seem a big thing, but actually it is really important. And you see that as soon as you go through the front door. To make the hospital more welcoming, again, there's been a number of refurbishments. And I think the Mary Lennox Community Room, as it was renamed, again, is a facility that will be able to be used by all people. And just touching on some of the other work as well, I'm sure people will be familiar that we introduced CAV 247, the phone first service, in August. And again, as part of that work and to ensure there were services in Barry, that we reopened the minor injuries unit. And then the final point, which again, I know you will all be very aware of, but we did have the urgent primary care hub in Central Vale, and we were successful in securing funding, which has allowed us to roll that out. So I've only touched on a few points there, but of course happy to answer questions and add any more detail as required. Thanks very much, Chair.
Thank you very much. Right, so I'm sure I'm going to have a list of people that would like to ask questions. Neil, did you want to go first?
Yes, please, Chair. Thank you. Before I start, what I wanted to say, you put in this bit at the end about the CAV 24/7. Personally, I think you need to publicise that a lot better than it's being publicised, because I think a lot of people are not aware of it, and it's defeated the object. I mean, it's a good idea, it's a good initiative, but unless it's rolled out so that everybody knows about it, then it's not going to get used properly. I was going to say about the Sam Davis ward, though, is I mean, it's no secret that that when the proposal was to close the Sam Davis ward back a couple of years ago, and we had all those meetings in Barry and so forth, I was one of the ones that was jumping up and down, along with others, about how concerning it was, and that generally speaking, it was, in my view, a backward step. I'm pleased to see there's been some sort of rethink, and that there's now proposals for some beds to be retained, although there's no indication how many, how that's going to work. I appreciate the need for frail elderly to be returned home, and yes, in the long, you know, in the scheme of things, people are better off in their own home mostly, but some particularly frail elderly need increased care, especially if they suffer an injury or which results in hospitalisation, which then can require a gradual rehabilitation back to the home. It's unreasonable for them to keep taking up expensive beds in UH Cardiff or Llandoch, and the need for an interim placements so that rehabilitation and assessment can continue is still hugely needed. I'm pleased to see now that that's being seen as being the role of for the Sam Davis in a more practical way. I mean, I was never very happy with the fact that it became a bit of a parking site for some people who were stuck in there for longer than perhaps they needed to be. And yes, that movement needs to go on either to get them home with the support that they need and have that all planned and in place before they get home, or if that's not possible, then to move them on to the appropriate residential facility to support them as they go forward. I mean, I've got a kind of an interest in this because my mum's now in residential care and has been for a year or so, 2 years coming this May, and doing very well. But she remained at home and was supported very, very well by the Vale with care up until that time. But as she became more frail and more demented as the years wore on, then and had falls and so forth, it became very clear that she needed that kind of assessment, and the role of the health board in achieving that was important. That, I think, as it's being designed, as you're talking about it now in terms of the newly revamped, I guess, Sam Davis ward, I'm a lot happier with that than the idea of closure that was being mooted way back. Thank you very much.
Would you like to answer that? Or do you need an answer, Neil?
I don't particularly need an answer.
Right,
Basically,
okay.
I think I'm telling
Yeah.
Lisa that I'm supporting the changes they've made.
Yeah, I realise that. Thank you. Anybody else like to ask a question? Rachel?
Thank you, Chair. Sorry, the hand raised facility is not working. I did try, so I used my hand. Thank you very much for the presentation, Lisa, and a little bit from yourself, Len. I'm just wondering, again, totally aligned to Neil's comments. I'm really glad that we have listened to the humongous public engagement. Without that public opinion, none of this really matters. So I'm really glad that that's come through adequately. But as Neil quite rightly said, we need sort of more specifics and how it's all going to roll out. That needs to be clearly communicated to the public. So I really want to sort of press that point quite hardly. Please let us know exactly what this is going to look like. And then that fits into my question really, which is this all started with the older person's frailty assessment unit. So how does that fit into that, and where are we with that now? That's the first question. And I just wanted to speak with a different hat on then as a CHC member. So perhaps if you wanted to answer that question first before I go on to the next observation as a CHC member. Is that all right with you, Lisa?
Yeah, and other colleagues may want to come in, and I think that maybe we didn't put it across as clearly as we could have before. And I think we did start with looking at a different model of care. But I think we probably started with we need to close those type of beds, rather than starting with actually we need a different model. So I think that was probably something that we've learned in trying to describe the whole picture. And as Ian may want to come in and say a little bit more. But just to pick up as well, in terms of the comms to the public, we haven't done any engagement yet. The plan was we would have done engagement just before COVID. Some of the stuff that I've shared were some of the feedback, obviously, from speaking to yourselves that time, and from sort of general feedback that we were getting. We would, of course, be looking to do a proper engagement, and which we haven't done yet, but we were just sort of sharing with you, I suppose, the way that we would be framing that engagement. And there will be things that haven't been flagged up before that we would need to consider. So hopefully that picks up on some of it, but I didn't know whether Ian, who is one of my colleagues, would want to say a little bit more on the frailty side, the frailty model.
Yes, thank you, Lisa. So I'm Ian Hardcastle. I'm the General Manager within Integrated Medicine of the Health Board, to have an overview from a management perspective. So as you know, the Sam Davis ward is still operating, and we fully support that in that respect. And patients usually that occupy the ward are elderly patients that have been transferred from UHW or UHL, and they're usually Vale of Glamorgan patients that no longer need an acute hospital stay in that respect. So patients continue to receive rehabilitation as well as support complex discharge planning at the St David's ward. In relation to the frailty model that we talk about, we're still working through that frailty model to understand what that looks like. And as Lisa's mentioned, in terms of the engagement, it's absolutely critical that we engage with councillors and the public to continue to develop that model. We spoke during the engagement and consultation sessions previously, I think it was in autumn of 19, wasn't it? We still have a view around what that frailty assessment and the older person's assessment looks like, but because of COVID and because of the way we are, we haven't taken that forward any further at this moment in time.
Understand, yeah. Really pleased to hear that, Ian. This feels so much better. I mean, I think the public opinion was just, I think we were all very surprised, but it was very clear about the need, the want, the necessity of this, however you want to call it, like a step down care from, as you said, UHW and UHR is absolutely imperative to the well-being. And yes, it's Barry, but we represented all over the Vale of Glamorgan. It came from as far as Western Vale right through. So yeah, I'm really encouraged to hear that these things are being listened to, monitored, and more importantly, perhaps that you're going to be actioned. That's really good to hear. Very positive. Thank you.
Thank you. Does anybody else have anything they'd like to say? Stephen Griffiths? No? Been answered? Okay, yeah, I have a few points I'd like to make. With regard to your presentation, the last but one slide where you say central to the new model of integrated health is providing care closer to home. The Barry Hospital provides local residents with ease of access to a variety of healthcare services, 24/7 minor injuries, blood tests, Sam Davis rehabilitation wall for the frail and elderly, etc., etc. At the workshop, which you mentioned, held in Barry Hospital in December 2019, to look at the future of Barry Hospital, it was stated that an audit would be undertaken to gain accurate knowledge of the services and clinics already offered in the hospital. This would then form a basis for looking at what services were needed to improve the facility at Barry Hospital, to prove an integrated healthcare provision for the local community. Has this audit ever been undertaken? Where can a copy of this audit be accessed if it has been undertaken? And what gaps were identified in provision? Can anybody?
Do you want me to come in?
Yes,
yeah.
Please.
So in terms of it, and in terms of the audit that I was aware of, there was, so there's a few things. There was an audit in terms of how the rooms were utilised there, because I think that whilst we were looking at what could we provide from Barry, there were comments made around, well, there is space that maybe isn't being utilised as well as it should be. So I am aware, I must admit I haven't seen all the detail, but I am aware that there was an audit and a look at the use of the rooms, and then that would have been used to help inform how much sort of space would be there, could we sort of increase the number of services there or the times that they are operating through that. But I don't know much more than that on that audit. And then in terms more generally of looking at what services we're currently running from Barry Hospital, and then picking up on some of the comments from the workshop and maybe the sorts of things we would want to see there. I've got a short document that I pulled together with my team on that. It hasn't gone anywhere. That would have been helping us to form the basis of some engagement and seeking people's views. But I've certainly got that as a working document that could be shared. It was obviously done at a point in time, but it was dated at a point in time. So they're the only two things I can say in relation to that, Chair.
Okay, because it would relieve pressure at Landog if there were more outpatient clinics there, in line with your policy, which is to offer some of these urgent services close to home in a community setting.
Yeah,
And it would also be in line with your eco policies as well, shaping our clinical services.
yeah, so what I can do, Len, if you're comfortable, it was only a working document, but we did, as I say, have a table that sort of showed the current services at Barry, the comments that were made sort of in the workshop, and bearing in mind, and you know, Suzanne will back me up in her role then, we had lots of bits of paper, but we did capture them into themes. And then we put it, we may have called it an ask column, but that would be what we would be engaging on. And picking up on what you said, outpatient facilities was one of those. The MIU linked to the out of hours service, and I think what we've been doing through the urgent primary care model. It was around the intermediate care provision. So we talk about the step up, step down beds and possible short-term beds. Diagnostic and screening services, sort of primary care mental health services, which I know are there, but also other primary care services, and then things like antenatal children's services and sexual health. So it is a working document. It would have been what we would have been looking at to help sort of shape some of the discussions around engagement, but as long as it's taken in that spirit, you know, I'm happy to share that.
And I've got no problem, Lisa, with you sharing that. I think
Thank you.
I go along with what the chair says. It is in line with shaping our future well-being and care closer to home, and it does actually support a lot of the transport and our decarbonisation and all of that agenda as well. So it is consistent. I'd agree with that.
With you saying about keeping beds, will you have a portable X-rays device there, and is the X-ray department going to be able to X-ray everything? For example, feet. I know they don't X-ray feet there anymore. You have to go to Landoc. And obviously, my concerns about everything is travelling, people travelling with. And the elderly do find it difficulty. And then there is, of course, an on-cost, people having to get an ambulance to go. So if you could look into developing the X-ray department, I think that would be very welcome for an awful lot of people living within the Vale. Another question. The creation of a health and wellbeing centre where services delivered collaboratively, which was on your slide. At the December 2019 workshop, it was stated that there should be a move away from calling the hospital Barry Hospital. This change in name was opposed by many organisations, local residents at the meeting. Has this change in name been agreed upon, and if so, by whom? Where was the consultation on the new name, Health and Wellbeing Centre? Because it's used a lot, so it does give me fear. The local community needs to be engaged on this. And when the Barry Hospital was opened 25 years ago, which was probably a lot before your time, probably still in school, there was a competition held in the local community to name it, and the people from Bryn Havern School named the new hospital the Barry Hospital. So at the workshop in December 2019, it was stated that a bedded ward, the Sam Davis ward, would not be compatible with a wellbeing centre. So no wellbeing centre. It worries me because no wellbeing centre in other parts of the Vale has bedded wards, and a change of name for Barry Hospital would have significant implications for the future, I feel, of the Sam Davis ward. It really worries me. Prior to the pandemic, there had been a storm of protest by the local community of proposals to close the ward, as you're well aware. So if services are to be developed collaboratively, what services are these being referred to and by whom? Who will oversee this collaboration, and what role will this committee actually have in this process? Somebody could perhaps answer me on that.
Lisa, in terms of the name and the health and wellbeing centres, that's a name that has been was sort of derived as part of the strategy shaping our future wellbeing.
Right.
And it was it is a name to try and designate specific centres within specific communities to provide a health service, but also to provide a well-being service, because our strategy is about how do we keep people healthier for longer, not just how do we treat them when they're ill. So now we have to treat people when they're ill, of course we do, and then the facility will always have a role in that, but we're expanding that role to well-being to try and keep people healthier as well. So the name Health and Wellbeing Centre came about as a result of that, a broadening of the range of services that would be provided out of there, not as I think you've interpreted, i.e. more restricting of the services. So and it's a term that we use to talk about a number of different facilities, not just the Barry Hospital facility.
Oh, I'm glad you said Barry Hospital then, because if you are going to call it a health and wellbeing centre, could it be Barry Hospital and Health and Wellbeing Centre? Because I know that an awful lot of people in Barry would be opposed to it and upset, and I just wanted to bring that forward to give so that you would be aware and you can think about it. How we support people who are frail in the community is a central part of the role of Barry Hospital, and I think you have touched on this. Community beds are better close to home, and I think this reinforces the need for the Sam Davies ward, both from ease of access for the local community perspective and reducing carbon emissions from a climate emergency perspective. So can I say that from you there is a commitment to keep the Sam Davies ward open after the enormous efforts of the staff on the ward during the pandemic? Have any assurances been given to the staff about their future employment in the ward?
If I come in on that, Len and Ian, you may want to add. So I think that whilst we've said we do see the need for having these intermediate care beds, as Ian said, we are working through what that model would look like. And at the moment, as I say, that sits with the medical clinical board. But, we did have conversations, and this is probably the challenge today, because there were some early conversations a long time ago, and we probably need to look and pick that up. Whilst we've had COVID, and obviously we've opened more beds there, it hasn't been the right time. But, we have talked about different models in terms of whether those beds, which should be managed more by sort of the primary care team and consultants, if we're trying to link it more with reablement. So I'm just being very honest in terms of we see a need for beds being there, but they may actually be operated differently to what they are now. The important thing is that we've got the services there that meet the needs of the people in the area. So there wouldn't have been conversations with staff yet, because we haven't sort of worked that through, but that's just sort of sharing that it could be different to what it is now. Okay. I didn't know if Ian or anyone wanted to come in.
No. Well, the Sam Davies ward does support the frail elderly to get people home. I have received figures as to how many patients, when released back into a home environment, end up back in hospital. And in that way, the Sam Davies ward has been brilliant, because it can really make sure, and they pick up things that the hospital has sometimes missed when they send people home. And during the campaign to keep the Sam Davies ward open, it was acknowledged that the ward was able to access the integrated services within the hospital, the occupational therapist, speech and language therapist, ward doctor, dietitian, podiatrist, dentist, local optician and social services, to provide the valuable services including stroke, orthopaedic and medical rehabilitation patients, to enable them to return home, or where necessary, move on to the nursing home. So have adequate funds and staffing. I mean, you've just told me that you haven't worked on this model yet, So I just want to put these things forward. You know, I wondered if they would have adequate funding and staffing allocated to the ward to enable them to carry out their work effectively in the future, bearing in mind the increasing elderly population in this coming decade, of which I'm one, so I'm quite concerned. Anybody? Well, I think you've answered that in your previous answer, really, haven't you? I just wanted to put that back up there. The commitment to engagement prior to the pandemic, there was a huge effort to engage with the local community. However, due to the restrictions, I do acknowledge that this has been difficult. What efforts have been made to engage with the local organisations that have been closely linked to the Barry Hospital, such as Age Concern and Barry Seroptimists? Have decisions yet been made about consultation and future proposals to keep people in touch and in the community?
If I pick up on that then, so in terms of where we were, and we did have some conversations sort of after the start of COVID, because originally we were talking about, you know, linking in with the third sector organisations, running sort of events in the school and the other sort of sites within the area. So we had discussions, we had pulled together a timeline. You know, we had been looking around sort of an 8 to 10 week engagement timeline, you know, because we were very keen from the December discussions that we did speak to all the right people. We did, of course, pause that. What I would say again, that internally we had discussions as to, okay, we may not be able to do that face to face, but could we do it sort of through these sort of forums? And probably after some of the work that we did on CAV 247 last summer, where we did do a lot of engagement virtually, then I think our view is that it can be done. What we haven't done yet is sort of started that, because internally, again, I need to put that plan together and work it through. But we did have a plan for who would be involved, or the list of sort of stakeholders, and an outline time frame. I think what we'd be looking to do now is just to do it sort of virtually, really, which I had my doubts about initially, but my experience from CAV 247 was positive. So it will be possible for us to do it, but we haven't done anything at all yet.
I think it'd be good to be able to tell people that, and hopefully that when the pandemic is over and it's all safe, you will be able to do some open meetings and be quite verbal. You mentioned the Aroma Cafe. I just wonder, I mean, I understand what you're saying. It's nice when you go in, it's welcoming. The people in the cafe at the moment are working as receptionists because nobody knows where they're going or what's happening. I should imagine that the cafe's not running at a profit at the moment, because I never see anybody in there. Do you know how many people access this service and use the cafe? Those going for blood tests and clinics, visiting St Davis Ward. Have any local residents use this service, do you know? And how many staff regularly use the service?
I'm sorry, I don't know that. We could find out, but it's not any information that I've got, I'm afraid, Chair.
Okay. And you mentioned the refurbishment of the Mary Lennox room. How many community organisations are benefiting from this, or will after the COVID, hopefully? And has anybody expressed any interest in using the facilities? I don't think many people are aware of it. I think you need to get this publicised for people to know that it is available.
Yeah, and Suzanne will probably want to come in. I think for us, we've got it ready, and there was certainly a lot of interest in people using the room. But I think sort of during the pandemic, we've obviously been trying to minimise sort of footfall within sort of the hospital. But the facility is there. I've used it with some of the teams. I've gone down to meet with Barry in Barry with Suzanne and others. But Suzanne, do you want to share a little bit more? You're probably a bit closer than I am.
Thanks, Lisa. And I didn't want to cut across, but I just wanted to give reassurance to Scrutiny Committee members around that liaison with the third sector. And so I know that there have been conversations with Glamorgan Voluntary Services about how can this room be used in the future, who would need to access it, why would they want to use it, in order to try to embrace both an engagement and consultation exercise in the one breath, but also how those individual organisations wish to use such a facility, and so that certainly has happened. We have been limited by being able to actually open it to those community groups in the way that we would want to, because of exactly the reason that Lisa has indicated. But yes, there have definitely been conversations with organisations already that associated with Barry Hospital, and would have a potential interest in doing so, in widening that out in the future.
That's good to know, Suzanne. Going back as well to the 24/7 minor injuries, which has already been said, it's a very welcome addition to the services offered in the hospital. But I feel, as I think it was Neil said, that how wildly has this been advertised in the local press, etc., to inform local residents? Has a wide variety of press publicity been used? Because I've not seen any, or not just social media. Are local chemists, doctors, etc., publicising this? How popular is it to use out of hours working? Is it quite popular? Is it used in the evenings and at night time?
Yes, if I pick up on that, and Len and others will know, CAV 247 took over my life for a few months in terms of trying to plan that work, and there was a lot of communication. So there was a detailed communication plan. We had sort of lots of coverage on the television. We shared lots of information with stakeholders, including primary care colleagues. So all the primary care contractors had information on the service, what would be different. There was a lot on social media as well. I do understand that, not everyone is into social media. Again, briefing with our CHC colleagues, and that it hasn't stopped. So we did some initial sort of media stuff around the time that we launched it. We were then aware that, we did have some younger people who were still turning up to the A&E department. So again, we targeted some comms for the younger people, for the students. So that we had stuff on buses. So there was quite a lot. We can again share a bit more detail around that. You can never communicate enough, but my personal view is there was a lot done there around CAV 247. In terms of it being used, we probably are having around 200 calls a day, which we're saying are specifically CAV 247 calls. We of course have merged that with what was the out of hours number, and in terms of numbers, around 2/3 of those are booked in either to the EU department or to Barry MIU, and then 1/3 of them are managed with sort of primary care and advice. So those numbers have been quite consistent since we launched at the beginning of August.
That's good to know, thank you, because people do ask us these questions, so it's nice to be able to give the information. One last question from me, you'd be pleased to know. I understand as technology continues to develop, access to services could be made available at home. And also, whenever you ask an elderly person whether they want to go home or onto an extended care facility or a wellbeing centre, they're all going to say they want to go home, which is why I think the figures are so high for them actually returning so quickly. But how will you help the elderly tackle the media access for having to ring doctors and for results and things like that?
Yeah, I'm not going to say I'm an expert in all of this, but interestingly, some of the things that have been done in sort of places that you could say in Barry and some of those centres is around sort of organisation supporting elderly people digitally, so getting them comfortable with using that. And again, I think that in terms of, well, I would say, my grandmother at the time was probably better with technology than me. So it does vary, but I think there are organisations out there who can help. With our community teams, again, I think once we start to make some of that available, they can also help. We've been using some of the technology with some of our services more generally. So there is more to do. And I think it's probably just about working through what help is best for different groups of people and what's the best way for them, really. So it's not a great response, and it's more that we need to do, but I think we can provide the support working with our other partners.
Thank you very much for bearing with me with all the questions. So I thought it was really important that we have as much information as we can to carry forward. And I realise that you do have an awful lot of more work to do. So I look forward to the next presentation that you can give us back at this committee meeting. A few more questions, Rachel.
Thank you, Chair. I just wanted to pick up when you said about the advertising on the buses. Do you mean actually on the back of the bus? Yeah.
Yeah. There were advertising on the backs of buses.
I thought so, Lisa. It's great, but if again, when I talk to the older generation, actually, what would be more helpful is if you were to speak to them while they're using the public transport. So like a loop message. That would be a really good way of communicating. The chair has beautifully put together the questions about that digital divide. I think they were so relevant, Chair. Thank you for bringing them up. But these are the sort of things that, as it's been explained, this is where we bridge that gap. So yes, just having a loop message about the changes to care access and everything else, and also we should be utilising our domiciliary care providers. These people are providing care in people's own homes to the exact people who will be accessing this 24-hour care. So again, if they know, and if you arm our carers with this information, that's another very simplistic but effective way of communicating. Just some ideas, really, Lisa. But again, this is just because I genuinely care, and I do reach out and speak to people in a way that engages in how they want to be communicated with. But the digital divide bit, it's massive, but we've got to start somewhere. And just a little bit on putting the CHC hat on now, if you don't mind. But with regards to the access of primary care, again, this is archaic, I know, but it's really poor access, and the signage and the door entry. People have been struggling to actually get into the building. It's really poorly lit, particularly at this time of year now as well. And Len, I have to grab you while you're here. Fantastic that we've got a mass vaccination centre, but people, particularly outside the home view, are freezing cold. They're perishing while they're waiting for the vaccination. People are going away, so we're kind of being we're not being particularly proactive. How you combat that, I don't know, but I'm being inundated today with people having to queue outside in the cold. How we tackle that, but again, I need to bring this to your attention because it's a real issue for people here in the Vale of Glamorgan.
No, thank you, Rachel. And if I pick that up, I mean that's come through loud and clear from feedback from yesterday. And I know that the leadership up there are working on that. One of the issues, and we had this at Splot for a while, is people come 20 minutes early for their appointment, and I understand why people do that. Because they don't want to be late. But the problem with the way in which we're using these facilities is we need a constant flow through the facility to try and do as many vaccinations as we can possibly get, and we can't crowd people into closed facilities for the obvious reasons of COVID. So we keep putting the message out, and I'd appreciate it if you could as well, if your approach, it's get there on time, but don't get there early and try not to be late is the issue. Now we managed to sort that out at Splot, and we have been doing, I think, about 1,020 vaccinations a day over the same period of time as we've got home view open, and we had a couple of days in exactly the same sorts of experience as home view had yesterday. But if we can keep getting that message out about try to turn up on time, then the flow of patients through is such that we can maximise the number of vaccinations we can do, which I know is important as well to the community, and we can try and manage it. But the leaders up there, the senior nursing staff understand it, are onto it, and are trying to manage it.
Yeah. Okay, Len, I certainly will, but I'm not entirely convinced, timing issue is going to sort of solve this problem. I was thinking more along the lines of, if we could somehow put a marquee out with this access to hot drinks, anything really that, again, we're all within the regulations, but people are going and leaving, and that's, completely defeats the object, doesn't it? Because they don't want to stay. So huge food for thought, but I need to bring it to your attention. Thank you.
Thank you, Rachel. Lisa, did you want to talk on that subject? Then Neil, then Julie.
Yeah, thank you very much. It was just to pick up on that. So, we have, as Lena said, have had people arriving early. We have had people arriving with sort of multiple other people. I get some older ones will need someone potentially to help them. And I think, as Lena said, we have sort of over 1,000 going through in Splot. Splot is a bigger venue, but also I think the initial cohorts that were going through weren't sort of the older groups. And what we are finding is when people are coming into reception, they can't always hear so well. So it's taken a little bit longer in reception and clogging up. So there are a number of factors, and I think we need to be mindful of that, we are trying to vaccinate as many people as possible. But if actually, it is going to take longer for some groups of people, we'll need to factor that in. I'm sort of leading on the ops for the MASIM. So as Len said, we've picked it up with the team. We're also looking at the lighting and things there. So we're really keen to get it right, but just to give assurance that we have spoken about it as a team. Some of it will be, we've obviously got new people, we're trying to mix up experienced people, but it is obviously more of a challenge running the 3 sites. So I think we are making sure that we've got people there who can move them through, we've got enough volunteers, and we will look into things, that whether there is anything that we can put up, but we'll do our best to carry on addressing those concerns.
You're muted, Chair.
Neil?
Yeah, Julie's got a hand up. Let her go first. She hasn't spoken yet. And any other councillors who might want to chip in first as well.
Julie?
Yeah, thank you. Because I live across the road from the home view, I've been back and forth since it's been opened. And the average is like half an hour. I've heard of nobody staying out there that long. The only complaints I've had is people parking on double yellows, which is about 5 lengths, about 5 cars can get on it. I'm working on that now, and I've approached people on the double yellows, and most of them, they don't even come from the Vale of Morgan. They haven't got a clue where to park. It's been rammed up here, but that's fine. But the only complaints I said has been people on the double yellows, and when I've asked, they said no, we've been waiting like 15 minutes, something like that. And I've just asked them they can park in my street if they want, because I don't want the council, because people have been complaining. I don't want them to be booked on that little patch. Apart from that, I've known people and it's gone really smoothly, and it's been like, 20 minutes. That's it. I haven't heard of anybody waiting out in the cold.
Okay, thank you. Neil?
Yeah, thanks, Chair. Unless there's anybody else wants to chip in first. No. Right, in
No.
that case, in terms of home view, one of the reasons I think people are turning up early is because some people are reliant on public transport. They're getting buses. They get there when the buses get there, not when the appointment is time for. And yes, they want to get there a bit early because they can't rely on public transport to be on time. So you've got that problem. It is inherent. It is going to happen. You've chosen a place that is actually quite isolated and difficult to get to for most people, at top of the hill and way out, and therefore it has inherent problems. So you're going to get people turning up and having to queue. In terms of the renaming exercise that we talked about earlier, in my view, renaming exercises are usually expensive and futile. The Prince of Wales Bridge is still the Severn Bridge. The Millennium Stadium is not the Principality, and the Heath Hospital is still the Heath Hospital, no matter what people want to call it. Calling Barry Hospital anything different is probably a waste of time. If you want to bolt on the Wellbeing Centre to Barry Hospital, that might be successful, but trying to rename it to something else is just going to cost money with no effect. And finally, my final comment is I look forward to seeing the detail about the new proposals for the model of what's going to happen with Sam Davis Ward and at Barry Hospital. I would like to know particularly how many beds we're talking about. And if we're only talking about 2 beds, forget it, it's not going to work. If we're going to talk about a significant number of beds and the way in which those beds are going to be utilised, then yes, I will engage with you and I will support you and work hard with you to get it to be a success. But if it's going to be, I remind you that originally, back when this was all first mooted and we all jumped up and down about it, the talk was closing and losing all the beds back then. And yes, I'm happy that we've moved forward on that, and we now are no longer talking in those words. But I'll keep my powder dry until I see more of the detail. Thank you.
Thank you, Neil. Yes, we look forward to hearing the long-term future of the Sam Davis Ward and the added facilities to the hospital. Like scans, and we're wondering about blood tests. To look to see if they can be analysed in the hospital rather than off-site. So thank you very much, Lisa, Ian and Len for this evening. We really appreciate you coming down, and I do hope that you will come again soon when you have some more information you can update us with. Thank you very much.
Thank you.
Thank you. Bye then.
Thank you very much. Bye-bye.
Bye-bye.
Thank you. So that takes us on to agenda item 5. If I can find, there it is. Which is the report of the Director of Environment and Housing, the leisure management contract for year 8 performance report. They're asking that the committee consider the performance of the legacy leisure contract for year 8 and for us to review the performance of the legacy leisure. I think a lot of questions were probably answered in the last audit report. And my computer is collapsing. There you go, got it. In the last audit report. So if you need anything to be added, any recommendations to go forward, now is the time to do it. So does anybody want to take us through the report first? Dave?
Chair, if I can do that, that would be helpful. Just to remind members, this is the year 8 report. And I know we're very preoccupied with what's happening at the moment with COVID-related matters, etc. And some of that did impact upon the year, but the actual date that this report relates to is the 1st of August 2019 to the 31st of July 2020. There is obviously a lot of information contained in the report, and this year we've given you the full appendix of the annual report that Legacy Leisure have produced and are required to produce as part of the contract. I did want to draw members' attention to paragraph 2.5, which follows on from the Welsh Audit Report that was discussed at this committee at the last meeting. I think some members were aware I was slightly disappointed with some of the recommendations in that report, in the fact that I felt Welsh Audit should have looked a little bit more at comparison figures of the price of contracts across Wales and how well our contract was operating in comparison with others. We have now undertaken our own research in relation to that, and I'm delighted to say that financially our contract is performing better than any other contract in Wales. When you actually look at what we're charging the charging the customer, we do extremely well in comparison. I wouldn't claim that we're the cheapest place to swim, but we are in the lower quartile, and certainly our membership fees in terms of gym memberships, etc., are also in the lower quartile. And I think combined with the financial results that I just previously spoke about in comparison with our prices, clearly we're doing something right, because the contract wouldn't be able to operate as economically if it did. The only opportunity really that Legacy have to generate income is through attracting more people through the doors and more paying customers as such. And obviously the economics of that is something that our contract is doing particularly well with. I'm joined tonight, and we're all joined tonight, by Colleen Tumulty, the Regional Director of Legacy, and also Rob Oaten, the Contract Manager. And together with myself, we're obviously happy to answer any questions you've got regarding the performance of the contract, regarding what's going on, and I'm sure there'll be some COVID-related questions into what's happening at the present time.
Thank you very much. Does anybody have any questions of the Legacy people who've kindly come? Rachel?
Thank you very much, Chair. Thanks, Dave. Thanks, Rob, for your attendance and the report and everything else. Couple of questions. Firstly, about maintenance. I'm just wondering, from the point of view of when we are in a position to reopen, how are we maintaining things like the pool and water usage? Just thinking up along the lines of Legionnaires and stuff like that. You know, is there regular checks so that when we do get the green light, you know, we can literally hit the ground running? That's one of my questions. I'll leave that there for now, if you like.
I'm happy to respond to that. Exactly that. To hit the ground running, we are ready. Yeah. We require a small window of time to reheat the pools. Mm-hmm. Not knowing a reopening date, we can't maintain that water temperature. It's not economical to do so. Mm-hmm. Having had experience from the first lockdown, we know how long it takes to heat our pools.
Which is how long?
In the summer, when the pool hall was warmer, it was about 4 days for the longest for Penarth to get up to temperature. But it's now winter. The pool hall, the air in the pool hall is cooler, but we've got our covers on and everything like that. And Barry, for example, we've got a steady stream of contractors in and out the site anyway, so we've needed to have the heating on for some of the works that's going on there. We are very proactive with this. Legionella, we've got our appointments booked in with a 3-week lead time, which they are on standby. I've also got home testing kits. I can keep going on, but we are, as soon as we know we can open, we will be opening. Trust me.
Lovely. Rob and Dave as well, I put out a bit of a social media ad with my own home gym here, my homemade gym, and I've just asked for people to engage on how they want to see the leisure facilities across the Vale of Glamorgan reopen. I've got to say it was excellent response, really positive. People are saying that they like the appointment systems for slot times to use the gym, to use the pool, to access some of the other services. I just want you to be mindful of that. That's really good public opinion. Some negatives were about usual stuff, cleanliness, etc. That's my main reason for raising that tonight, as I feel that probably the most appropriate time. So again, just in terms of hitting the ground running, people want the gyms open. You know, it's overwhelming, the response I had. But yes, safety, effectiveness, cleanliness, and really good clean access is what came across loud and clear. So I just wanted the opportunity to feed that back to you tonight.
I think one of the advantages that we've had with Legacy, and one of the things they've been able to do very quickly, has been their online presence and the implementation of an app that's allowed customers to sort of book regular slots. And we saw that when we came out of the first lockdown, and obviously had a great deal of advantages. Obviously, what we're desperate to do in Barry is show off our new changing rooms, because obviously the dry side changing rooms are now complete, as well as the wet side changing rooms, and it's very, very frustrating that we're not actually able to share those facilities with the public at the moment. And obviously we've also got a new sports hall that's been laid in Barry. Other works that have been done in the other sites, and just to emphasise what Rob was saying earlier, sites are being checked on a very, very regular basis. Obviously we don't want any problems when it does come to reopening. The buildings are ready to go.
Great. Just two more little things, if I may, Chair. Is that okay? Going back to the previous scrutiny committees, which again, due to COVID situation, we didn't get to explore further. But one is the car parking situation. Just want to sort of rear that again with regards to when we are back up and running. We were looking to do a survey with some of the staff, etc. So where are we with that? And secondly, looking to do some sort of arrangement or agreement with Forces Fitness to get our older children into leisure centres. Again, just a really good initiative to re-engage with the public. So we're looking at year 6 as in high-end comprehensive year 6 children. Love to give them an opportunity to have a session with in the gym or all the facilities. It's just another initiative I'd like to put forward at some point. I've had some really encouraging conversations with Sean Molino. He's the Forces Fitness guy who's currently carrying out all of the fitness training for our primary schools here in the Vale of Glamorgan. So again, it's a food for thought, Rob, but I would really welcome a conversation about this. I think it's got a huge amount of mileage, massive investment in our young people, and now at the most prominent time where everybody, feels particularly rubbish, with obviously situations. So we're hitting every aspect of our mental health objectives, engaging with young people, which again is massively on our agenda, fits perfectly into this scrutiny committee. So would welcome a conversation about that at some point as well, please.
I would also like to discuss that further. We're struggling with, since obviously COVID's kicked in, contact with schools is naturally dipped. They have had their huge struggles themselves. So leisure, apart from the benefit we have at like Lansford, where we're literally on the doorstep and we're engaging with them every day, it's a challenge for us to engage with that demographic. So yeah, I would absolutely encourage a conversation on that. In regards to car parking, how long have we got? It's madness, in my opinion, that we have the busiest leisure centre with the smallest car park.
Yeah.
We reach a plateau with our members at Barry. It's around 2,200, and then we get about a dozen complaints a day, and then we dip below it. We can't exceed it where we are, and it's frustrating. And we have many of your colleagues and others that come into the centre saying they can't park there. And all we can say is, but we can't stop them. It's not us to manage. Yeah. We would encourage that there is specific designated car parking for leisure use only. And we've explored many options and ideas to facilitate that. But it's exceptionally frustrating over the months and years that I've been working within the Vale to see in the morning running on a treadmill at Barry, 8 or 9 people park in the car park and then walk into town, walk into the council offices next door, and not come into the centre, for only 5 or 6 more people come later and not be able to park in those spaces. So I'm keen, and I know Dave is as well, to have a strategy and success story behind resolving car parking at Barry. Further to that, each site has its own complications, but the risk to car parking in Penarth with the potential health hub on the cards is another factor to consider. And the proximity of Cowbridge being close to the town centre and being used as a commuter run, which is a very strange thing. I'm passionate to resolve these to allow our customers to use the centre when they want to.
Yeah, me too. Thank you, Rob. Thank you, Dave.
Thank you, Rachel. Thank you, Rob.
Thank you, Chair.
Neil? Councillor Neil Thomas?
Yeah, that's it. Just take off my, put my mic back on. Thanks, Chair. First, I want to congratulate both Dave and Rob and Colleen for what has actually turned out to be a very, very successful partnership over the years, and long may it last. And thank you very much for all your efforts on that. in terms of COVID, as we're talking now, how much of a hit are we taking? What's the proposals now for going forward in terms of we're stuck with coronavirus to some degree for many months, if not years. How is that changing our thinking, changing your thinking going forward? What plans do you have now to live with an endemic virus of that nature? And well, yeah, basically that's it. What are your plans in that regard? Thank you.
Would you like me to start on that? And I'm sure Rob will probably add, because Legacy, to be fair, have been obviously very reactive to what has been going on. And as I said, making plans in terms of apps, trying to make less contact with the customer, which seems against our sort of business principles that we've always worked against, but that seems to be what people want at the current time. And we've recently had some money that we've had from Sport Wales that we've been able to secure that will make access to the gyms available directly via cards, etc., rather than having to go to reception, which with the app booking as well makes things a lot easier. I think what we have demonstrated, Neil, is that we're adaptable to whatever the rules are that are applied, and obviously we're keen to provide the best services that we can within the rules that exist at the current time. We're aware that some of our competitors have had improvement notices, and one gym in Barry was actually closed down for disobeying the rules, and it's very, very important. And I think Legacy have very much taken on board that providing services on behalf of the local authority is very, very important, that they're compliant with the rules as they stand. And so far I've been very impressed, and Rob will probably talk to you about some of the equipment they've also invested in terms of being able to disinfect areas very, very quickly between different users. But you know, some of the frustrations from customers, whereas you used to be able to turn up, stay as long as you want, there's had to be some adaptation there, where customers now have to book for an hour's slot. We're restricted in the number of people that we can actually have for those hours slots, which in turn has an effect financially and in terms of the number of people that can actually use the facility at one time. And it's particularly difficult with things like junior swimming, where young people probably interact more than adults do when swimming, and that brought its own challenges when the first set of rules in terms of reopening were introduced. Again, we're very much in the hands of what we're told to do, and adapting very quickly to actually provide hopefully the best and hopefully the most inclusive service that is actually able for us to be able to offer at that particular time. I'm aware that Colleen's been struggling a little bit with a signal strength, so I think that's probably why Rob's answering most of the points, but I'm sure Rob will probably want to add to what I've said there.
Yeah, I think Dave summarises it well. Space is the biggest challenge we face, in that COVID requires a lot more of it, and our kind of maximising our space by putting as much stations in a gym as possible to try and encourage as many users as possible. That is a thing of the past currently. We are having to have treadmills 2 meters apart, or a treadmill in the middle that's not in use, and that has an impact. But at the same time, it's allowed us to think on our feet and adapt. We use more spaces better. Our programming is slicker. We can't have 2 users in the same space at the same time in many examples, and so we are adapting, but we are very much paired with hospitality in many ways with leisure, insofar as it's a struggle, and it's just about trying to encourage and provide that confidence back to our customers. A lot of them have come in, and I've been a lot more on the gym floor and on the shop floor reception than I ever have been, and it's been great to hear the feedback of, oh, I feel a lot more safer here than I do in the supermarket. Oh, can you provide me with bananas, please? And silly things like that is great. But it makes the community is still there. They're still happy. They're still happy to be there. They just can't mingle like they used to do before, and hopefully that will return. alongside all the cleaning elements, it's always the area that we will have the most complaints about, and that is something we will always be trying to improve upon. With COVID, we have touch point 2-hourly cleans in all areas. We've got a Zuno e-sprayer equipment, which are hydrostatic cleaning chemical which hugs to metallic objects, which is provides protection for up to 28 days, but we do it far more in excess of 28 days to provide that protection. It's something that they use on the London Underground, and there are many other measures that allow us to provide that customer confidence, which is key to get people to feel safe and comfortable to come back to us and exercise when they're ready, and we are ready for them when they are.
Thank you very much. Anybody else got any more questions? Rachel?
Thank you, Chair. Just to reiterate, we all know this, but it is the current government preventing the gyms from opening. I mean, there's a lot could be done there, but it's not my position to say at the minute. Two things. Could we look at taking the gyms outside, Rob? We've got all these open spaces. How can we think differently? And again, it's all about the re-engaging of people, building up the confidence. That's one school of thought. And the other one is the car parking. If we are going to be restricted to an app or a card, perhaps we could link that with the car parking space. Just again, that's another thought. Might resolve it.
Can I answer the bit about the outdoor activities? Because we're aware of a number of entrepreneurs, I call them, that are offering outdoor fitness classes. A lot of them on our land, etc., without our permission, and there's various issues associated with that, particularly where accidents and that occur. We are working with Rob at the moment and the team. Obviously, the weather at the moment isn't particularly conducive to outside exercise classes and the rest of it, but we are looking to introduce our own programme, which will hopefully have the quality mark that Legacy brings to our facilities, and we are looking at that with Rob at the moment. And again, we've managed to secure some funding, which will hopefully allow us to trial that in some areas and maybe some non-traditional areas that we haven't used before. So we are particularly keen to do that.
Excellent.
I don't know, Rob, if you want to add anything.
Yeah, exactly that, with activities and things. Additionally, outdoor spaces, we're exploring, and I received earlier today actually potential designs for converting the courtyard area in Barry to an outside exercise space, which I'm keen to do if we can attract funding and move forward with that. Currently, other areas are being explored. We could potentially look at classes and things as part of the funding Dave's expanded on the 3G pitches, the new 3G pitches at Colcott.
Excellent.
So yeah, there's definitely a driver to adapt our business to take things outside where possible. In regards to car parking and linking to your membership card, I did have a number of proposals with third parties which would link various methods of car park management, ANPR cameras and things like that, directly to a member's membership number, which could then allow them to basically park for free with the app on their phone, and then use the same barcode to get directly into the gym. So yeah, great line of thinking. It all has a cost to it, and it has to be in my view, it has to have as least number of hurdles for the user to get from their home to the gym. The more hurdles you introduce, the more barriers that prevents exercise and recreation. So it needs to be seamless.
Yeah, absolutely. Demographically, people travel 15 minutes to go to the gym, Rob, as you probably know. So, this is my one of my other passions. But just again, it's just a thought I had now. But we're going to have to think very differently, very laterally, aren't we?
Yeah.
Great to hear about the outdoor fitness. I think that's going to be the way forward. Thank you, Chair.
Thank you, Dave. Thank you, Rob. Thank you, Rachel. Councillor John Thomas.
Thank you, Chairman. Just thinking about what's just been mentioned then about outside exercise, which all sounds very well and good, but aren't we at the moment still restricted that we can't meet up with other people indoors or outdoors? So we perhaps a little bit premature on thinking along those lines. Now, obviously, it's okay to make plans for the future, but
I think that's the bit I would stress, that it's the planning that we're looking at the current time. And I'm just concerned about some of the exercise classes that are being advertised externally and the quality mark on them. And I'm hoping by having something endorsed with ourselves and working in partnership with Legacy to actually produce that, we'll have some sort of quality mark that I don't believe exists with some of the classes that are happening at the moment.
Thank you. Thank you, John. Thank you, Dave. Anybody else got any questions? No, I just got one quick one. Just to thank Legacy very much for allowing the use of home view for the vaccination centre. And I just wondered if we had been approached to use a leisure centre or a facility in the Western Vale for vaccinations, because it does seem an awful long way for people to travel.
I believe there are discussions occurring regarding that, but details at the moment I don't think are very clear. But obviously we're keen to talk to the health authority, as it's in our own interest to get our own facilities up and running as quickly as possible if we can assist in any way whilst facilities are empty.
Thank you, it's good to know. Well, thank you very much indeed, Dave and Rob, for being here and allowing us to question what's going on. Yeah, very much appreciate it. I think we've had a good debate as well. So thank you very much. Moving us on to agenda item 6, which is any item...
Sorry to interrupt.
Sorry.
You need to go back to the recommendation.
Oh, of course, yeah. The recommendation is to that the committee consider the performance of the Legacy Leisure contract for year 8. Is everybody in approval of that? Can I have a show of hands, please? Yeah, thank you all very much. Okay, Dave? Happy? Great.
Thank you.
So that definitely brings us to agenda item 6, which is any items which the chairman has decided are urgent. I have quite a few. No, I haven't got any. So stay safe, everybody. Please look after yourselves. And if you are travelling, watch the ice. I hope your animals are safe on the farm, John, and you're looking after them well. I'm sure you are.
I am, yes. They're fine. Thanks.
So good night, everybody, and thank you all very, very much for a very productive meeting. Thank you.
Good night.
Thank you all.
Right.
Yeah,
Thanks.
take care.
Take care, everyone.
Stay well.